Hi, everybody. This is Steve Neidlinger with the Pennsylvania Academy of General Dentistry. Thank you very much for joining us today. So, today I'm going to be chatting very briefly with Dr. Zach Sisler. Before I introduce you, Dr. Sisler, why don't you introduce yourself? Tell us a little bit about your practice, what really excites you about dentistry, what all would you like to share with the group?
All right, so a little bit about my practice is I practice in Shippensburg, Pennsylvania, a small little town in the middle of central PA. My practice is a little unique in that it has a specialty side and a general side to the practice. So I see patients, we're doing routine cleanings and fillings and crowns, but then we also have a highly cosmetic side where patients are kind of traveling from out of the area in to having work done, whether it be veneers or complex implant reconstructions. And so I think today kind of a good topic would be photography, because honestly, that's how I built the brand that it has become today for our practice.
All right, and I would really appreciate if we could talk a little bit about that. Dr. Sisler has kind of carved out a niche, I suppose you would say, an expertise in dental photography. And it's nice having that expertise so local to us here at PhD. He's written articles for us in our Keystone Explorer in the past, and really wanted to pick your brain a little bit about dental photography. We do case presentations at our master track, and it's good to have somebody who can give us some tips and tricks as to how to up your photography game. So, if it's all right with you, you about ready to dive into three quick questions?
Let's go for it.
All right, let's do it. So, question number one. Um, what are some of the uses that you have found for good dental photography, whether it be case acceptance, maybe malpractice defense, risk management, any uses either in your practice or that you have seen amongst your colleagues?
I think the points that you just kind of alluded to are great. I mean, some people think, oh, well, I can explain it to a patient. And I'm like, well, why not just take a photo and let the patient see for themselves? They can see if something's out of place. They can also see decay. They can see broken teeth. So for me, early on in my journey, I tended to talk a lot and I was trying to educate my patients. And I think any new young dentist can kind of fall into that trap. And the patient looks at you like a deer in the headlights, and you're kind of like, I got to talk more. When realistically, you don't need to talk more. You just need to step back. You need to take a photo and put it on the screen for the patient to see. Because then at that point, the patient really starts to say, wow, that doesn't look too good. What can we do about that? So for me, early on, it was patient education. It just allowed me to get out of my own way. And then secondly, what I started to do is, I took over a practice here in Shippensburg that it did a lot more gold and amalgam than it did porcelain and composite.
Hmm.
But I wanted to do aesthetic dentistry. And so I found that by taking before and afters, it allowed me to kind of expand that brand, helping other patients to envision kind of like what's possible, what they could do. And so really my cosmetic side of the practice was built on photography. And so we do a lot of different photography here in the office, whether it's routine, consistent ring light photography, or we have a full studio set up as well, so that when we have a patient who's traveled in from a ways away, we sit them in the photo studio and they say, wow, this is kind of different. And I was like, yeah, we're different here. Not with an air about us, but just that we take things to the highest level that we can. So in doing that, it shows the patient just how serious and committed we are to taking a photo. We have to be that serious and committed about the work we're going to do for them as well. So they take it with great sincerity of how we approach it. And so for me, like when I was a younger dentist, now I still like to think I'm young, but I realize that I'm transitioning into the older crew. But for me, I realized how important photography was early on in my career. And if I could talk to any other young dentist, I'd be like, you just need to get a camera. You just need to start taking photos. They might not be that great in the beginning, but they're going to help you along the way. It could be legalities, it could be case acceptance, it could be marketing, it could be before and afters for within the walls of your own practice. But it's just so, so important when it comes to photography, and when it comes to dentistry in general.
Okay. I want to explore a little bit further when we get into the second question. So you mentioned about your studio and setup. So tell me about uh, tell me about some of the, I guess you would say, pitfalls or technical problems that can often come up, either maybe with lighting, maybe with if you're using mirrors, how do you get around mirror fogging, those types of technical problems that can happen with the typical photography.
So let's tackle those two,
Okay.
basically the lighting and the mirror.
All right.
Those are two common things. First, lighting is it's a lot of learning, okay? Meaning from the standpoint, you've got to just take photos and you've got to learn, hey, that didn't turn out so well, so what do I got to do to change it? And it might be that you need to change a setting on a camera, or in my studio setup, a lot of times I'm changing the settings on the lights themselves in order to get a better flash outcome for the patient and for the image that's coming back into the camera. Now, you flip side that to, hey, we're going to take studio photos, but we're going to use a ring or we're going to use a mirror. That's a challenge because in my studio, I don't have air to blow on the mirror to keep it from defogging. However, I have found a little contraption that you can buy on Amazon, which is a mirror that has air that's being blown onto it from the handle. It's very inexpensive. You can purchase them if you look at fogless mirrors on Amazon, but it's worth its weight in gold. And so, for any young dentist trying to learn how to do this, or any old dentist who's been taking photos for a really long time, that was a real game changer for us because now I can take the photo by myself, or my assistant can take the photo by themselves and avoid having to have so many people just to get one photo. So those are two things. One, you've got to practice and you've got to actually do the photo. Two, you've got to find little tips or little kind of like pearls like this fogless mirror to help you along that journey. But there's been a lot of trial and error with that. This isn't something where I picked a camera up and it was great the first time. It's a lot of the school of hard knocks, as I would say.
Okay, good tips. Last question. So you mentioned uh, not everybody's ready to take that step to set up an entire studio for good photography. But let's say that you are somebody that just wants to get started out. Let's say maybe a new graduate or somebody who's just getting into their own practice for the first time, and they want to start basically dipping their toe in without doing the full dive. What are some tips you would recommend for somebody who wants to get into better dental photography but on a budget?
So I think the easiest thing there is to look for like a package deal. So meaning when I talk about photography or I teach dental photography, it's still with a good quality camera and something that's not going to necessarily break the bank, but it's worth it because whatever you pay for that camera is going to pay for itself in the first case you do. So when I first got started, I went to a company called PhotoMed. I do not get any royalties, any endorsements for using them at all, which I maybe should. But anyway, the reason I say that though is they specialize in dental photography and they're used to dealing with people who are new getting into that photography world. So they'll sell you like a package and they'll say, hey, here's a package that you can use. It'll have the camera body, the lens, the light, and everything you need to get started. That way, you're not trying to piece something together off Amazon or going to a local photo studio or store and trying to make your own work. They're very specific and then they're able to help you. So if you call them, say, hey, I'm having this issue with my camera. What can I do? They'll walk you through it on the phone. So and I think that's kind of the intimidation factor for a lot of new dentists getting into it. Well, they didn't teach me this in dental school, or I don't know how much is realistic to spend on something like this. They'll coach you through, hey, here's an entry level. We'll help you with it. And then if you have issues, we can also help you on the back end with it. So that to me, I think provides a lot of peace of mind for a young dentist. And that's probably a good starting point.
Okay, excellent tips. Well, those are my three questions. But before we sign off, any advice or words of encouragement for anybody that really wants to up their game? What would you recommend?
Ooh, I would say I would probably end with this quote. The journey to success is often not a straight line. So even though you buy the camera and even though you have the support, you still have to be able to put the camera up to your eye and take the photo and just get started. You've got to start somewhere. And there's some days where you might be trying to take photos and you feel like you're really gaining ground, and then other days where you took three steps back. But the point is that you're still moving forward and you're trying to grow and get better at it. So don't let the fear kind of cripple you. Allow it to kind of embrace you, like meaning allow it to push you forward.
Sure. So it's like anything else in dentistry. You're not going to be excellent right off the bat, but you're going to continually chase that until you're just getting better every day, I suppose.
Absolutely.
No, fair enough. All right, Dr. Sisler, thank you very much for sharing your thoughts with us. I appreciate it. PhD members, I recommend getting out there, trying to do a little more with your dental photography game. I recommend picking up Keystone Explorer. For those who want to find Dr. Sisler's article, you're welcome to go into the publications part of our website and find it for it and give it a read. So, Dr. Sisler, thank you very much for sharing your thoughts with us today. Very much appreciated.
My pleasure.